Well, we're here with Dr. Osterberg, a chiropractor in Pennsylvania, in York, and I think a couple other offices. Hi, Dr. Osterberg.
Hello, Mr. Flash.
Dr. Osterberg, tell us a little bit. Chiropractors are known to have different philosophies here and there, and neither one of them is probably bad or good, just different philosophies. Some chiropractors really very specialize in one particular area of the body. Other chiropractors deal with many more things. Tell us a little bit your way of practicing, your philosophy, your belief in what makes chiropractic so powerful and usable for patients.
Absolutely. I'd be happy to. You're right. There are many different philosophies, many different approaches in our profession. Our approach is an evidence-based approach. And what that means is that we only do what the research has proven to be effective for our patients. But it's not just about the technique that we use on patients. It really has to do with our philosophy of treatment in a whole. Whether you're a dermatologist or you're a dentist or you're a chiropractor or a family doctor, the evidence-based approach really helps you get better results. Let me give you an example of that.
Please.
When you go see a doctor, you take a few things for granted. You assume that the doctor that you're going to see, that he's up on the latest research, that he knows the most current information about your condition. You also assume that your doctor is going to use that information to provide you with the safest treatment possible for your condition. You also assume that your doctor is going to try to get you the fastest results possible, and that he's going to try to give you treatment that will give you the longest lasting results possible. And the last thing we assume is that our doctor is going to help us save money, that if he can treat this condition for $1,000, he's not going to give you a treatment that will cost $3,000. And the research helps us, being evidence-based and looking at all of the current evidence. It helps doctors of all types to provide the fastest results, the longest lasting results, the most cost-effective results, and to provide the safest treatment. And that is really our approach for back pain and neck pain and headaches.
Okay, so back pain, neck pain, and headaches, are those the main symptoms, illnesses, or whatever it is you are working with and trying to solve?
Absolutely. Over 90% of our practice is back pain, neck pain, and headaches. And, of course, with back pain, there's also back and leg pain, sciatic symptoms, or neck and arm pain, and neck and shoulder pain.
Okay. All right. Good. And again, but just to summarize about this evidence-based, give me. So a person comes in with back pain, which is, I'm sure, there's a lot of people having back pain. How do you go about? What is one of the first thing a patient in your practice could be expecting to do or not to do?
Sure. The very first thing that we want to do is find out their history, because back pain can be nothing but a simple sprain or strain, or it can be the first symptom of something that's very serious. So we need to find out about their history. We do an examination. We look for red flags, the more serious medical conditions, and we want to rule those things out. The next thing we do is examine the patient. We develop a treatment plan once we determine what is the most likely cause of their back pain. We establish a baseline to find out where they are as far as pain and function. And most of our treatment is really geared towards function. We want to monitor the patients, not just how much pain they have, but what is their ability to perform normal activities in life. And as their function improves, we want to move this patient towards an exercise rehabilitation program to help prevent the problem from coming back. So our goal is to get people pain-free, fully functioning very quickly, and then get them on a preventive program of exercise, mostly done at home, so that they won't need as much care in the future.
Oh, wow. So basically you're not trying to, as you mentioned before, if a treatment can be performed for a few $100 versus $1,000, or for $1,000 versus a couple thousand, then part of the doctor's job is to perform it for less money. And so I guess your whole treatment remedy thing must be contributing to that, to the lowering of price, quite heavy.
Yes, absolutely. You know, chiropractors tend to get a bad reputation, and maybe it's deserved or maybe it's not, for trying to see how many visits they can get this patient to come in. You know, that's one of the jokes about once you go, you have to keep going forever. And that may be true for some patients that are in such bad shape that they can never get back to normal, and they do need some kind of ongoing care. But as a doctor, our goal should be to get people back to normal as quickly as possible and try not to develop a dependence where they need to continue seeing a doctor if it's not necessary. That's at least our goal with all of our patients.
Well, that seems to be going right along with what most chiropractors are saying, and which I think is very true, and that is chiropractors don't really heal and cure many illnesses. They just assist the body to cure itself. Is that a relatively true statement?
I think it is, yes.
Okay. So now, obviously, if you show a person to do the right thing, you obviously, he probably needs some assistment called adjustments and whatever it is you do, and we're going to talk into that later, to get out of the main thing. But then the maintenance, the correct movements of the body and the joints and whatever, probably will keep him there, or at least, keeping there for a while. So that has to do with, he can do it himself. And that, of course, is like with everything. You want to have a secretary, but it helps to know how to write yourself, right?
Absolutely.
So yes, you want to have a doctor who comes in, or you come to him and you get guidance and you get this type of stuff. Same with a lawyer. Yeah, you might want to have a lawyer to get advice, but in the end, you got to be staying legally, not the lawyer, right?
Absolutely. We're there to help people when they're not able to manage it themselves. But if we can help them get out of pain and also help them prevent the next injury or the next episode, then we've really done them a good service.
I appreciate that. I'm sure this is very helpful information to people watching. It definitely was good for me. Bye-bye.